Good afternoon, and welcome to Expanding PT Practice into Health and Wellness Services as we explore the implications of PTs working in the evolving healthcare sector. My name is Michelle Thorman, and I'm privileged to serve as the Vice President of the FSBPT Board of Directors. I join you on this cloudy day from Western Wisconsin. Today, we welcome our speaker, Paul Welk. Paul wears two hats, both as a PT and an attorney. He's a graduate from Duquesne University PT program and the University of Pittsburgh Law School. Paul's legal practice focuses on business and healthcare law, where he represents physical therapists, rehab professionals, and other professional organizations. Today, Paul will help us better appreciate health and wellness roles and how they fit into the PT scope of practice and their impact on PT licensing boards when trouble arises. He'll carefully guide us through both the opportunities and maybe even some unexpected landmines that exist as PTs expand their practice into this health and wellness arena. So thank you for joining us today, Paul.
Thanks, Michelle. And I'm joining you from equally cloudy Pittsburgh, Pennsylvania today. So I appreciate being invited to talk to the group. I think from just a couple of sort of early housekeeping items, from my perspective, I'm certainly happy to take questions. Obviously I've got some slides that we need to cover and some content, but I'm sure that many folks will have comments that will help the group or otherwise have questions that I may be helpful to answer. So just a little bit more about myself solely for purposes of I think it's helpful perspective for this discussion. I am a physical therapist by background who now practices as an attorney the last 20 or so years. I do maintain my physical therapy license here, in Pennsylvania. But when I was contacted, about presenting to the group and asked the question of sort of what do you see and provided with some possible topics, this one sort of came to the forefront because it's a question that I get, day to day on, my legal practice. Now we have done work over the years for Federation, represent a number of chapters as well as hundreds of providers, whether it's private practice or facility-based or otherwise. And we get a lot of questions about, the expansion of physical therapy practice into these, health and wellness settings. And ultimately, what does that look like at the end of the day? And how are those integrated into practice? And I think a lot of those, I realize, again, that I'm here today to speak about practice acts and scope of practice and those licensure type things. I think a lot of those, questions are driven by, other aspects like what does the reimbursement look like? How can I integrate this into my practice and generate cash-based services? So a variety of things that I'll touch on, throughout the presentation. So with that, we can go ahead and get started. And again, I would encourage, questions or comments along the way. I believe you can simply unmute yourself and ask a question if you wish to do so. So with that said, we can go ahead and get started into the formal portion of the presentation. So I think, my first slide here is just my standard disclaimer slide. We're talking about a variety of different topics. Certainly if you, in your role on your, professional side or in whatever role you may serve on a state board or within the Federation, have these particular questions, obviously they're, Practice Act or otherwise legal specific. And you can look to your specific laws and counsel to get advice on these issues. From an objectives perspective, I'd like to start with a discussion on the Model Practice Act language as well as some other states in particular language that they have around the topics of health and wellness services in physical therapy. I'd also like to talk a little bit about again current trends related to fitness, health, and wellness, and how those ultimately, play into our discussion today and into physical therapy practice generally. And then, I think from an overall regulatory perspective, again, I understand the purpose of this is to talk about licensure issues and scope of practice and related items. Ultimately, there's a fairly large cascade, I think, for the licensees in your particular jurisdiction on some of the answers as to whether, are these within my scope of practice? And ultimately, what does that look like? So it's not only licensure, but it is items such as, ultimately, is there reimbursement for those services? How is my malpractice insurance affected by what language may be in my Practice Act, or in some cases, not in my Practice Act, as well as other specific regulatory matters that come into play when you think about the integration of these items, into physical therapy practice. So as a starting point, I just like to look at a couple of the definitions and professional association comments and documents that are out there, on issues of prevention, wellness and fitness. And the slide that you're seeing on the screen now is an American Physical Therapy Association position paper, that speaks to the role of physical therapists in this space, specifically, their role to incorporate concepts of prevention, wellness, fitness, and health promotion, and to ultimately, use skills and behavior change to promote health lifestyles in individuals and communities. So from a big picture perspective, if you think about how, the National Association looks at this, obviously a key item of importance, they've got a position statement on it. That position statement is available and speaks to items like, the training and education of the physical therapy community, and how that's a direct interplay between the ability to provide these services and the unique space that physical therapists are in, given all of the settings that are served and all of the patient populations that are served, to really affect the fitness, wellness, and health of the community. So that's the position from a national association perspective. And obviously, relative to this group, we've got the Model Practice Act language, with the practice of physical therapy, including, the reduction of the risk of injury, impairment, functional limitation, and disability. The key language here, including participation-focused exams and the promotion and maintenance of fitness, health, and wellness in populations of all ages. So obviously, over time, the Federation has looked at this, and there are numerous prior iterations. For those of you that, have been involved or care to see the historical perspective, of changes to this language and changes to this concept over time. So I think it's fair to say at a high level that the importance or the integration of these items, into day-to-day physical therapy practice has increased over time. As I stated earlier, I'm in cloudy Pittsburgh, Pennsylvania, so thought I would, pick on our Practice Act a few times here. And, I remember, back in 2008 when we had our most recent set of Global Practice Act changes put into place, we spent a lot of time as a state association advocating for this language. And again, as you can see sort of in the middle of your screen there, this includes the promotion and maintenance of fitness, health, and wellness, in populations of all ages. So, clearly, was a key issue, both at the National Association, within the Model Practice Act, and then with numerous states, again, Pennsylvania here, just by way of example, in terms of, the language that is included there. So I think, and just to kind of set the table a little bit in terms of kind of a theme that you'll see carry through this, which I can only describe as ironic when I talk about, the amount of time that many states, Pennsylvania included, have put into, the concept of fitness and wellness and how to get these things into practice acts. A lot of the questions that I get, and you'll sort of see this, but I'll kind of preview it now, is what I'm doing within the scope of physical therapy? And oftentimes the question that I get is, okay, how do I get it outside the scope of physical therapy, potentially? And that may sound funny at first, but I'll explain as we go through a lot of those questions. And, there is certainly some gray area, some greater gray in some states compared to others. But in terms of, how this falls within the statutory and regulatory framework of a particular scope of practice, in a particular jurisdiction. So I think if we look at that analysis, again, if I receive a call in my office and somebody says, hey, I'd like to talk to you about fitness and wellness within physical therapy, my first step is to say, okay, let's talk about your Practice Act and regulations and what may or may not be in there. And I think it's helpful, to look at a couple of different, acts and interpretations. I think, we've just taken a look at Pennsylvania. So fairly clearly, again, Pennsylvania expressly includes these terms within our definition of physical therapy as included within the statute. So, although there are no such things as advisory opinions in Pennsylvania from a state board perspective, in my opinion, I think it's fairly clear that, health and wellness and those things are included within Pennsylvania. There are many states out there where it's not as clear. So sort of that, in my mind, middle ground, where they may not expressly use those terms, but they may not, certainly exclude them otherwise. I think that the third example, and my expectation, I'm not here to pretend that I've looked at all 50 states and done a deep dive as to who allows what, but there is, if you go on the Kentucky State Board of Physical Therapy website, just by way of example, they have an opinion and declaratory ruling where a number of years ago, they were presented with a question about whether an individual who served as a licensed physical therapist, or if an individual who was a certified physical therapist assistant, could provide and lead group instruction in various wellness, fitness, and obstetric programs. So this question was brought in front of their state board of physical therapy, and I'll read their response because I think it's helpful for the group to sort of show the variation of how these services have been treated. Their opinion is essentially, the board interprets the general functions of pre and postnatal classes, general calisthenics, preventative back exercise programs, and body mechanics instruction not to be the practice of physical therapy as defined under KRS 327.010 subsection 1. So clearly in that state, again, if we're looking at the spectrum of how these services are treated within the scope of physical therapy, I think that's helpful. I'd like to read one other section of that Kentucky opinion because I think it's helpful and it comes up a little bit later in some topics that we'll talk about. But it reads, such persons who are credentialed by this board should not call themselves physical therapists or PTAs during those services, which may be misinterpreted by the public that those services are being provided as physical therapy services. The PT or PTA's assistants shall not represent the instruction as carrying out physical therapy or providing a therapeutic service. And then it continues to go on throughout the opinion. But I think the take-home point, at least in terms of this board's position on this particular day in this decision, was that those services do not constitute the practice of physical therapy. So once you consider sort of those initial questions and points on scope, that sort of that answer then tends to guide, a lot of the subsequent discussion and analysis on, okay, that physical therapist that's out there in the field working on a day-to-day basis, ultimately, what does that look like for them? And I think it's helpful to sort of look at a few different subsections of kind of how that initial answer might ultimately, affect where things go forward. The first thing I'd like to talk about a little bit is, malpractice insurance. So let's say that first answer is, that wellness and fitness services are within the scope of physical therapy practice. Well, if I have an issue while I'm providing one of those services, presumably that's favorable for me as the licensee and the insured, because generally, coverage for services under a malpractice policy is for those services within the scope of practice of that particular physical therapist. So that first answer, again, we sort of went through that continuum, everything from expressly within the statutory or regulatory language all the way to at the other end, arguably expressly outside, what should be described as physical therapy services. That answer may put, what would otherwise be the same individual with similar insurance coverages in a different position if there were an issue that required coverage under a malpractice policy. So I think that's sort of the first two bullets summarized here is, ultimately, what does that look like? And ultimately, how does that affect your coverage? If you are providing these services and you would happen to be, you or one of the licensees in your jurisdiction, uh, be in a state that expressly does not look at this as pure physical therapy services, then the thought, again, on the sort of regulatory requirement side is okay, our State Practice Act may require 1 million, 3 million in coverage, but if somebody's practicing outside of it in their promotion of, these types of services, should they be thinking about, individual insurance coverage that may be outside of, what I would call traditional malpractice coverage. And I think there's also an interplay here between how you describe the services and malpractice insurance. And what I mean by that is I'll go back sort of to my comment about, some of the irony of the very common questions I get in terms of, is this within the scope of my physical therapy license? And the follow-up question is, is there a way that I could set it up so that this, particular service that I provide is not? So I think, one of the things that was listed within that, Kentucky opinion is, how are services presented to the public? And when somebody calls me and asks these questions, one of my common answers is, well, if you're telling me you want to make it clear this is outside the scope of physical therapy, for whatever particular reason, maybe you're in a state where there's a level of ambiguity, if an issue arises and the patient is injured, I would strongly suspect that you may have a slightly different position on whether you were providing physical therapy services, is that if that depends on whether you have access to the malpractice coverage that you've secured to protect, your well-being. Because again, if it's outside the scope of services that you can perform within your license, then at least in my experience, you have some risk of it not being covered under your malpractice insurance policy. I'd like to talk a little bit now about reimbursement. Before I do that, some of you may have some familiarity with HPSO, a large insurance provider that does a lot of work in the physical therapy space. And they have, just informative, and if this is something that's of interest to you, they do have a case study that's published out there that looks at, a wellness clinic and how it operated and some of the issues that arose, related to its operations. It was performing, in many cases, what it described and proposed to be traditional physical therapy services under that wellness umbrella, but ultimately one of the issues that was highlighted there, and I want to, bring it up here because it's in this HPSO case study, is, if you are performing these services, how do they ultimately fall within issues related to, licensee delegation or supervision? So, for example, if you are if you have a robust health and wellness program that you may be operating in your particular practice, and someone comes in new to the clinic, what does your front end look like from an evaluation perspective? Is that something where the way you have your particular program set up, oh, this is a pure wellness program, for example, this isn't traditional physical therapy. Does that person, need an evaluation? Do they need documentation? What does that look like, and how have you assessed that under, your practice act, and what you're going to be providing to this individual, and how does it relate? Again, if you find that to be an area of interest, I'd refer you to the HPSO case study on physical therapy licensure protection, specifically, related to how that may function in the wellness clinic setting. So I'd like to talk now a little bit about sort of the regulatory side of reimbursement and how it plays into what we just talked about. So, ultimately, again, in the world that I'm in, many of the calls I get from your licensees are, hey, I'd like to provide this service line. Insurance either doesn't cover it, or maybe they cover it, or I want to add something that's in addition to what's available to insurance. How does that ultimately get paid for, and what does it look like? So I think on the payment side, obviously there are various payer sources that our licensees receive reimbursement from, whether it's insurance, whether it's some line of employer-related services, whether it's direct from the patient or client. But I think, how those services are ultimately presented and provided, affects this significantly. And what I mean by that is, for way of, by way of example, Medicare has very strict rules on, when you can accept, or more appropriately, when you cannot accept cash from a Medicare beneficiary for services. So if you are providing, traditional physical therapy services that would otherwise be covered by the Medicare program, you'd have some restrictions. Goes back to my, common theme here of, okay, is this person operating within the scope of their physical therapy license, or are they not? And at the end of the day, is, as we all know, you can't take your license and put it in the drawer and make it go away for a while when it's convenient for you. And I'm sure, many of you have preached that to one audience or another over time. That said, it's often asked of me of, well, everything I do in life, I'm not a physical therapist. Are there things that are, not pure physical therapy, whatever that might look like? And how do I try to think about, how this plays into my practice act, my scope definition, and what do I have the ability to do? There's also, a second element to that, and that I'm not going to spend much time on it, but in terms of insurance payer contracts. So generally, my insurance contract, if I'm a physical therapy practice, says if someone comes through and hands me a card for their insurance, I need to run it through that. I need to treat it, appropriately under the contract. That's why I signed it. So when we see individuals looking to create programs or sometimes get into the health, fitness, wellness space, they're often looking to sort of structure these programs, certainly with a lot of regulatory pieces in mind, the pieces we've covered so far, the scope of practice, issues related to delegation, reimbursement side, and malpractice coverage, and ultimately, what does that look like? Maybe I'll just pause for 1 second and see if anyone has any questions. I don't see any coming through, but want to make sure I'm not missing them, since I've only got a few faces on my screen. If there's hands up, I apologize. I can't see them all.
Paul, I don't see any at the moment.
Okay. Thank you for checking. I'll pick back up with the next slide then.
And if there is anyone, just go ahead and unmute your mic and ask your question.
All right, I will continue forward then. So, one other thing, and this is not an ethics lecture, nor am I an ethicist, but I do want to bring up that, relative to some of these, scope of service questions, and Practice Act, and sort of this global concept we're talking about, health and wellness is, if health and wellness services are included within your Practice Act, should you make an effort, or however we want to describe it, to provide those services within the scope of your license, so that to the extent there are, other options for, reimbursement, or other ways that those services, are paid for, that you're availing the patient of their ability to receive that. Again, it's just something that comes up sometimes in discussion where, okay, we have two choices on how you can receive services. One is through our sort of traditional physical therapy practice, and one is through our kind of augmented health and wellness program that we run, sort of, if you will, separately, or in parallel to our traditional PT practice.
Good. Paul, may I interrupt you for a moment?
Sure.
One of our participants writes, so how does a physical therapist work in the health and wellness space outside of their physical therapy license, or is that not possible with Medicare?
Um, I think it is possible. The key comes down, in my mind, I guess, to a few things. I'll answer the question here. There may be a little duplication later in the slides, but I think there's a few things. Primarily to me, it's, what is the service that's being provided, maybe as a first step. So if you are providing a service that's, clearly not otherwise reimbursable, for example, it's not medically necessary. The patient or, client in your example has, no diagnosis that would make it appropriate to receive physical therapy care. They're not otherwise, reimbursable under the Medicare program. You make it clear to them that this is a service, outside of what would be, again, reimbursable or appropriate under Medicare. In my experience, that's the way most folks look at this and tend to structure it. What you could not do, stated another way, is say, hey, I'm going to provide, traditional physical therapy services and, under the Medicare program. When I say traditional, I mean, medically necessary reimbursable services and seek to charge the individual. But on the sort of the flip side of that, if you're doing something that's clearly not physical therapy and clearly in the, outside of that realm, that's what I see most folks do from a, positioning themselves to provide services outside of, or at least outside of physical therapy as we look at that from a Medicare perspective, which, as we all know, may not necessarily align with the scope of practice in the licensure law. But on the Medicare side, that's the way I see it addressed. If there's no other questions at this point, I'd like to switch gears and talk a little bit about documentation.
I have a question.
Sure.
My name's Larry. I'm in Myrtle Beach, South Carolina. Most of our patients come in have a bunch of comorbidities that affect their health to begin with. And in our initial assessments, very often we're taking vital signs and we're reporting BMI and other issues that may be things that will interfere or enhance their overall recovery. So part of our training is to do those assessments, report them, and justify what we're doing in terms of patient education to address issues such as obesity, nutrition, within the scope of our practice, because it's necessary for outcomes for patients to recover, and give them the tools to be able to continue on either with therapeutic exercise or other education, diabetes education, or education in general. That's, generally part of our practice. The other thing is, which I have done, is I've gone for outside certifications through ACE, the American Council on Exercise, and I'm a health behavior change specialist, and I got certified as a senior geriatric specialist through their organization, as well as a health coach. Now, I don't build separately, or I never build separately, but I did have the credentials to back me up if some of those things they thought they were out of my scope of practice. I do have certifications in those, but that I incorporated those into my usual PT treatments. Plus, I have degrees in integrative medicine. So I did a lot of outside work to become very well versed, including, and when I was teaching at the college, I introduced motivational interviewing, which is a health change, which really, when I first learned that in 2020, I said, why didn't I know this 20 years before that? Because I'm practicing 57 years already.
It,
But
it,
it was something and I have a master's in exercise physiology. So I felt and I ran adult fitness programs for my local JCC. So I had experience, I had credentials, and I felt very comfortable in getting my patients oriented towards health and wellness. That was a big part of my practice.
yeah, and I think part of the point of that, or at least what I'm hearing out of that, I should say, is that, certainly on a day-to-day basis, there are components of this in probably every patient interaction on every given day. I don't mean to imply, and maybe some of my statements did, that it's sort of, hey, you're A or B. But I think your point, Larry, is well taken in that, every patient that we see, we are incorporating these. Obviously, you've got a longer list of credentials than most, but taking that training and education and including it in a typical physical therapy assessment, evaluation, development of a plan of care, and I think that's an excellent point.
Yeah. I have one other thing on my malpractice. I take a rider with HPSO as a consultant because I also do, and again, I don't practice as a health and wellness outside of when I was in the clinic. Um, but I do expert medical witness stuff in malpractice cases. So I take a rider on my malpractice insurance should there be any questions about consulting. So I think that might be the health and wellness, because there's a very broad term under consulting. I could say I have separate malpractice. And I know there are organizations, if you are credentialed as health and wellness, you could just buy very cheap malpractice for that specialty, which I would do if I was doing it outside of clinical work.
Yeah, again, I think another good point. I think depending on what your particular practice involves, whether it's, what I would say outside of the traditional, physical therapy space, whether it's that consulting, I actually believe they used to have, and maybe they still do, some type of a similar fitness component. I know we're not talking purely of fitness here, but my
Yeah.
recollection is that they had a similar rider for those folks that were doing, again, I would call it sort of outside the traditional physical therapy services on a day-to-day basis. So,
If you were a personal trainer, you would have malpractice insurance anyway,
mhm.
and you would get informed consent. If you're a legitimate personal trainer, those are the guidelines that they follow or should be following for credentialing. So, hopefully there's a lot of people that are legitimate doing this, although I know some people on the side that don't. But, overall, I think anybody that's really professional is going to do the right thing and abide by the guidelines.
Yeah, that's
Code
well
of
said,
ethics.
Larry. That's well said, Larry. And thanks for your comments and the important work you're doing. Um, Paul, it seems like we don't want to move on to documentation quite yet. There's a couple more comments about
Oh,
changing hats. Tracy writes, if a physical therapist is seeing a client for wellness and something changes during that session that requires traditional PT knowledge and skills, does that PT just change hats? And later, Jeff writes, this issue of changing hats between PT and wellness provider came up in APTA House of Delegates years ago. One of the potential issues that was raised was that if everything we do is technically physical therapy, then we potentially invite, perhaps in an unanticipated way, non-PTs to claim that they are providing physical therapy services if they are also providing similar and the same wellness services. There's a lot to unpack there.
yeah, yeah. I think it's a very good point, and I think it goes to a lot of things. Some, again, if we essentially reference in that Kentucky opinion, and we are, when I'm talking to folks about it, it's really, how ultimately is what you're doing being described, to the individual. And I think, well, we're not quite in the documentation. If you look on the screen here, sort of in this, you know, maybe the second, third, and really fifth bullet here when we talk about sort of how is that presented and what does it look like, and understanding Larry's comment of, hey, we're always doing some level of wellness and health as physical therapists. I think if you are truly doing, I'll call it almost a separate service line, or you have a distinct program where you say, hey, do you want to participate in our fitness, health, wellness program? We do see people that are using, documentation to very clearly describe, what services are being received, what services are not being received. Um, and I think a lot of it goes into the presentation. It's probably, somewhat short of a gym waiver that you would sign, but it's much closer to that than it would be your informed consent document that you'd sign if you came in for a physical therapy evaluation or went in for an appendectomy, or whatever that looks like on more of what I'd call the medical model side. And I think, when you look at that fourth bullet on the screen, exclusion from services, that's intended to talk about that example of, okay, you've come from the wellness side and suddenly, you've come to me today and said, boy, is my right hip sore. Can you take a look at it? Okay, then you're in sort of that gray space of saying, okay, you know, where am I now? And I think, the way individuals in my experience generally deal with that is, okay, you're here today for wellness services. If we feel like you need, traditional physical therapy, an evaluation, a plan of care, billable to insurance, within the scope of the license, all of those things that you tend to see. And again, probably not the best word, but I'll say traditional physical therapy, then that's where those folks are sent. Again, that may end up being you in certain cases. I think you've got to be, a little cautious about too much bouncing back and forth, but we certainly have, this situation come up, and that's my general advice on kind of how to deal with that. So I think if there are no other pressing questions, maybe we'll continue a little bit more on documentation. I think we ended up hitting a handful of the points here, but I'll add just a few others. I mean, I think if you are sort of advertising your services, in my opinion, if you ever were called to defend yourself for whatever this particular circumstances are, and you say, hey, these are, fitness and wellness classes by Paul versus fitness and wellness classes by Paul, the physical therapist. I think that's an important distinction. I realize, again, we always have our license, and probably part of what you're promoting is that high level of training and education to provide those wellness services. But I do think you need to be a little bit cautious in terms of holding yourself out as a physical therapist and not putting yourself in a position where, if you look at a malpractice case, right, you have a duty of care to the individual. So back to our example, if I suddenly say in my wellness setting, oh, sure, I'm more than happy to look at your sore hip, jump over here, I'll give you a 5-minute evaluation and we'll adjust the exercises, suddenly, okay, what have you just done? Have you opened yourself up? Do you now have a duty that could potentially, pull you back into physical therapy despite what you've told the patient in terms of what they're going to, ultimately receive? And I think, again, kind of going at these in reverse based upon the discussion, when you think about how do these services, get documented, certainly if you go back to Larry's example and you have a traditional physical therapy patient and this is, ancillary to your care, you're under the Practice Act, it applies, you're documenting that evaluation, plan of care, ultimately a discharge, and making sure all that's in place. We certainly tend to see, much less of that in, again, sort of if you were pure wellness or, pure, fitness health component that, many of the practices, maybe operating under. And I think on the documentation side, just to sort of show you, a couple examples here, here's the Model Practice Act language on responsibility to document, right? So again, if you're within that scope of physical therapy practice and subject to the terms of your particular state's act, here, again, Model Practice Act in Pennsylvania, Pennsylvania even goes into a little bit more detail in their unprofessional conduct provision. It says unprofessional conduct is, you can read it there, failure to maintain adequate patient records. And then they go further and define adequate patient records to include at a minimum, patient identity, but then summaries of findings of an examination, evaluation, diagnosis, plan of care, outcomes, treatment records. I think I'd be fairly comfortable saying that a lot of folks that are exploring or starting to push this space and promote it within their practices may not document every particular case, with the level of detail that's described, in the Pennsylvania legislation, or in this case, our administrative code. I want to talk a little bit about other regulatory issues that touch on, again, ultimately we're just stemming off of our original discussion on, okay, how does the scope of practice analysis affect, ultimately many other things that cascade from that initial decision. I wanted to touch on a few here that are particularly relevant. One is HIPAA compliance, right? So again, everybody on here, you live in the regulatory world, a lot in state licensure laws, but from a HIPAA perspective, are you subject to HIPAA with what you're doing when you're providing, wellness related services? I would say in most cases, in my experience, you likely are, right? If you're a covered entity that's providing services, I humbly think it's difficult to sort of not do it sometimes and do it some other times and try to figure out, which people are in it and which people aren't. I'm not saying you can't do it, but I think from a HIPAA compliance perspective, it's a little tough to say, hey, what I'm providing here is somehow not subject to HIPAA. Regulations, many of you may be familiar with the anti-kickback concept, but let's say we have that patient that we were asked about earlier on, with the questions about sort of bouncing back and forth. So let's say hypothetically, I'm treating a Medicare patient, he's a great patient. I want him to keep coming back here. So I say, hey, every time you need to receive services under the Medicare program, you keep coming to me. And instead of what I should charge you for the wellness program, which is $50, I'll charge you 10. That's a problem because you're giving someone a discount, basically something of value, so that they'll keep coming back to you and getting all their Medicare services from you. So that is problematic. So for those that are, contemplating, these, wellness programs, whatever they may look like in your particular mind as you roll them out, be conscious of the fact that, you shouldn't be giving discounts to current patients so they never go anywhere else to PT and they keep coming back to you for services. You need to be cautious of infringement on other licensed and certified individuals. Again, I think it was Larry who made the comment about personal trainers or athletic trainers or sort of others that may be, into this space. I think, of the regulatory issues that are out there and risks, I think this is relatively on the lower scale. And what I mean by that is, given the training and education of a physical therapist, and certainly if it's within the definitions of, your scope of practice in your particular jurisdiction, I believe you have fairly low risk, but it's something to be, conscious of if you're, contemplating getting into those particular services. And the last thing here I'll highlight for those that, again, have licensees that are interested in this space. States have some funny rules on health clubs. And what I mean by that is, let's say that you were operating a wellness program and you said, okay, if you, pay a fixed fee of $500, you've got a year membership, almost like a gym. There are states that look at that under their consumer protection laws and say, hey, you need to do things, for example, like be bonded, so that if you close down in a month, all of your patients and clients just didn't lose a lot of services that they ultimately, chose to pay for. I put this here at the end just because I think it's an interesting area and it fits, at least to me, on the fringes of the topics that we're talking about. And that is sort of new areas of physical therapy practice. We see a lot of physical therapists from a lot of different settings working more and more directly with employers. I think it's the same issue in large part. I've listed here a few things that physical therapists are doing in that particular space. Some of them are performing more traditional, work comp or physical therapy. I don't think there's much of a question there. But again, if you're going out and signing a contract with a large manufacturing facility to go on site and perform, preventative exercise programs or wellness programs or instructing and stretching. Again, I'm not saying that these are outside the scope of physical therapy by any sense. What I'm saying is you just need to be, conscious as we continue to talk about, ultimately the risks and how that's presented. And again, what does your particular practice act allow or not allow in terms of, what you can do when you start to explore, what's in this space. I think the last piece that I wanted to touch on, and then we can, open it up to questions, is just a little bit more about delegation, right? I didn't read, 50 plus practice acts coming into this, but I'm fairly certain that all of them speak, in fair detail about what you can and can't delegate. I'll go back to my earlier example. If you're in your physical therapy setting, whether it's in a hospital, private practice, wherever it may be, and you've established one of these programs, sort of what does your upfront screening process look like? If I come in off the street and want to participate, do I see a physical therapist first? Is there some level of screening? Is there a level of documentation to that? Do I go straight to, somebody who may be in your office under your supervision or not, whether that be, hey, we have an exercise physiologist that runs this program. That may go a little bit to the gentleman's comment, I believe it was earlier on, that Michelle relayed about, hey, do we start to blur the line if we're kind of, bouncing back and forth? If I have a wellness program that's run, in my clinic purely by unlicensed individuals or non-physical therapists or whatever the case may be, does that make things more difficult down the line? Or does that lead to questions about, hey, if we can do this, should we be able to do that? That's, arguably physical therapy. And I think ultimately, if you look at the case studies that are out there in terms of, again, back to things like malpractice, if there's an issue in your clinic, what does that ultimately look like? I will bring up one more comment that I thought was interesting. I participated, many years ago in a mock trial that we did through HPSO at a presentation. And what that particular group did to sort of mitigate some of the issues that we've talked about is they literally had their, health and wellness staff wear different color shirts. So they were the red shirts and the PTs and the PTAs were the blue shirts. And then it was one of their techniques of saying, hey, we were very clear, if there were ever an issue. And I think it was helpful for many ways. It was, hey, you knew what you were doing. You knew why you were there. You knew who you were seeing. There may be a month where your hip hurts and you're seeing the folks in red because those are the physical therapists and the physical therapist assistants. And then you may come back 3 months later and say, hey, I'm here because, I could really use, somebody pushing me a little bit on an exercise bike or, helping me through a non-medical issue so that I can, get myself in better shape, whatever the case may be. So that's what I had in terms of content. I'm not sure if there are other questions, but I'll open it up for the last 10 or so minutes here to the group.
We have a couple more items in the chat, but if others would like to unmute and ask your question directly, please do so now. I'm reading a comment by Sonora, the wise woman that I know and love. Is there any wonder that the public is confused? If we take the title of doctor and all the other folk providing what seems like the same thing, have we really progressed the profession or just ways to make more money and bill for something?
Yeah, it's a good point. And again, I go back to my comment about the irony, where here in Pennsylvania, we work and work and work to get these included within the scope of physical therapy practice. And now the last number of years, I get so many questions on how do we try to, for lack of a better way to say it, move it out of there or move it to the fringe of there. It's certainly a good philosophical question. And I concur with the comment. I think for whatever reason, a lot of the folks that I'm hearing from are trying to figure out how to make it work in their particular business so that they can stay above board and stay above water economically.
Hmm. Yeah, wait for a little bit more time for people to submit chats if they wish. And Paul, I think what I'm hearing from this is that um, to the best that you've been able, you've drawn some lines between wellness and fitness and traditional physical therapy, but you've also helped us get more and more comfortable with the gray zone. And unfortunately, the gray zone is bigger than the direct lines.
Yeah, it is. And I'll be curious, and I know much of this never becomes public facing, but I'll be curious for those that sit on the boards and are involved in this process, on a day-to-day basis and looking at investigations and, looking at complaints and, whether or not these issues come up more. Someone, for example, saying, hey, I knew Paul was a physical therapist. He had a red shirt or a blue shirt. I don't know. I thought I was getting physical therapy, kind of regardless of what the program documentation said, and does that lead to licensure board complaints and those type of things. And I certainly hope that's not the case, but it'll be interesting to see whether these types of issues, in whatever form they ultimately come in, become more in front of the various state boards that are participating on this discussion.
Hmm. And speaking of that, if any of you on the call have experienced any kind of complaints or had to act on a license regarding health and wellness and where this fits in the PT practice, feel free to unmute your mic or also put your comments in the chat room. One of our participants, Paul, says, I feel like much of this has to do with third-party payers, where the payment stops before the patient is really ready to return to the activity. We need a way to help patients in that phase.
I would agree. Many of these questions that I'm asked about how to establish these programs, whatever your preferred term is, or maybe none of these are your preferred terms, but aftercare programs or, medically oriented gyms or, but a lot of what we see are those folks that are discharged and for whatever reason, sometimes it's because they just want to continue to exercise and be well and work on their health in a comfortable environment. To that comment that was raised, sometimes it's probably because you know they're not quite where they want to be, but for whatever reason they've been discharged from formal physical therapy care. But I would agree with the comment. A lot of it is driven by how does the physical therapy practice continue to provide what I would say is a valuable service in a way that they can be paid for it.
Mhm. Yeah. In my in my free time, I'm proud to be a Live Strong instructor for cancer survivors. It's a program through the YMCA, and fortunately, I don't have to have reimbursement. But I do find myself walking that fine line between when am I a Live Strong instructor promoting wellness and when am I a PT. And I'm grateful to have both of those skills, but it is a consideration that I take in consideration every single time I teach. Thank you. Let's see, we've got another comment. And it relates to the same thing about working this dilemma regarding payment, and that it'll remain an issue for a long, long time, as long as we have payers that are part of our healthcare system. I appreciate
And
your comments.
that was my comment about the third party payers. My name's Lori, and this is a whole nother conversation, but we're not doing ourselves any favors by letting the third party payers think that physical therapy is really finished or these patients are really well at that point in time so that it's fine to discontinue physical therapy because we've found a workaround to, capture them on the back end under another label. So, I have mixed feelings on this that I think in some ways we are doing a disservice to our profession by doing that, but yet we want to help these patients. So anyway,
Yeah,
Thanks, Lori.
I would agree with that. I think it's a good comment. I think it's probably a very fine line between that premature discharge person that ends up here versus that person that may come in and participate in the programs without the diagnosis. I think there's a lot of set of facts, but you're right. I think if this is making the appearance to the payer community that, Paul was 100% ready to go and we discharged him because he met every goal, but really we needed to put him for 2 weeks and do another program to get him where he should have been at the time of discharge. I would agree that's a problem.
Paul, the issue of pro bono has come up here. Can you speak to any adjustments to the thinking of what you presented, not for payer-oriented wellness and health, but in pro bono situations?
Yeah, I mean, certainly from a big picture perspective, I don't know that necessarily affects the ability to provide the services pro bono, through whatever organization that you are involved with. I mean, I think you'd still think about some of the same things like, do I have the appropriate malpractice coverage? Presumably the reimbursement issue, goes away. There may be considerations on, financial need or financial hardship that may go into some of the, pro bono analysis that we didn't talk about. But I think many of the issues would ultimately, carry over, whether it's, got the same scope of practice issues, whether you're pro bono or not, presumably, the same insurance coverage issues. But I think it would change pieces of the analysis, but I think a lot of it would carry the same.
Thank you. Such good comments. Clearly, this is an issue that we haven't covered all the gray areas yet. We have about 4 more minutes. Are there any others on the line that would like to unmute and offer your comments before we conclude?
Yes, this is Gina Ogston. I'm an instructor in a DPT program and also a transitional DPT program, in which both we have content that addresses health and wellness. And I think if I may summarize from what I'm gathering from what everyone has said today, I really appreciate, first of all, the therapist that says, I can't divide myself from health and wellness. I think it seems to be a topic that, many of us as PTs identify with, that it's just integrated into what we do. I think that's separate a little bit. But what I feel like the message is that when you're, as a PT, if that's all that you're doing is health and wellness, that's when things get pretty gray. Did I kind of summarize that correctly?
I'd say so. And I think, again, I think it was Larry, the gentleman you mentioned earlier. I think it's part of everyday practice as you teach in your particular program. There's a component of it in every visit. I think where it gets more difficult to deal with is that, discharge patient that's continuing, or that patient that comes to you through some type of a, non-typical PT, type service line where you say, hey, we offer this, but we now have this as an add-on. And that's where I think it gets more gray, to use kind of Michelle's analogy, is when someone's coming in and doing something other than walking through the door and getting an eval by one of your DPTs, Jenna.
Yeah, absolutely. And I think I did a presentation at CSM about nutrition and the role of the PT in giving nutrition advice. And every state is quite different on that. But it's just kind of, so you have to be careful with how you're doing that. But also, I just think about it. Well, I tell my students, you're not a nutrition counselor, and that is right. Can you speak a little bit about general nutrition, because that's part of our health and wellness? In the realm that we have a population health crisis. And so I hope this certainly doesn't scare people away from incorporating just general health and wellness conversations with their patients, because we have a long way to go in the health of our society.
I agree. And I sure hope it didn't scare away people from
No.
talking health and wellness with patients. I think, if anything, my hope is it helped to explain some of the differences and issues to think about. Again, I think most of this discussion, was centered around not the type of health and wellness advice that, Larry talks about, which is in every visit, but more if you bifurcate off of it. And I think it's always been a part of practice. I think what we're starting to see as an emerging area over the last, number of years is more of a concentration on this as a piece of a physical therapy provider and sort of how that's kind of nuanced over time.
Absolutely. Yeah, I appreciate it. This is really well done. Thank you. Very informational.
Well, we're coming up on the top of the hour, folks. Jenna, that was a great way to conclude our discussion. Paul, if I could have a moment of personal privilege, um, please say hi to your father for me. Your dad was incredibly important to help me through my DPT program when we both graduated with our transitional DPTs from Temple University. So I can tell our audience that Paul comes by his competence and compassion, honestly. And to the
Thanks.
rest
I
of
will
you,
pass that along. I'm sure you helped him more than he helped you.
thank you for joining us today. We have one more webinar that'll be coming up on December 17th with Dale Atkins. It'll be the greatest hits of 2025 interesting cases. So tune into that if you have time as the holidays approach. And speaking of that, thank you for your roles as regulators. And as we think about our upcoming Thanksgiving, I'm giving thanks for the fact that I'm in a profession of regulators and community that cares so much about the work that we do. Wishing you all a happy Thanksgiving and continued success in your roles. Goodbye from FSBPT.
Thank you
Thank
for the
you.
presentation. There were like 80